Hello everyone, welcome to today's lecture in epidemiology. Today we'll talk about case control studies. I'm Hao Mingyang from the School of Public Health, Fujian Medical University. So as we previously have mentioned about when we talk about how to test the association between an exposure and the outcome, we can conduct a cohort study. Then in a cohort study, generally we need to identify a large group of people and follow them for a very long time before quite some people will develop the disease and that we concerned about. However, if the latent time of the outcome disease is very long, such as 10 years, then we have to follow up for quite a long time, and if the disease incidence is very rare, the sample size must be very large, and even the investigation becomes impossible. In this situation, we can propose an alternative design to test the association between the exposure and the disease. That is so-called the case control study. So in today's lecture, we have several contents to talk about. The first is about the definition of a case control studies. The second is we will illustrate some examples of case control study. And we will talk about matching in the study design for the case control studies and follow up the specific design for these studies. We will also talk about the data collection process and how to analyze the case control studies. In the end, we will introduce about the strength and the weakness of case control studies and compare the case control studies with the cohort studies. So first, let's see the definition of the case control study. The case control study starts with the identification of persons with the disease of the interest. So the disease of interest in this study design is the case. We call them the case. And the control group of persons without this disease, we call these controls. So when after we get these cases and the controls, we need to measure the association between the exposure and this disease by comparing the disease and the non-diseases persons with regard to how frequently the exposure present. So let's see that we start from define the disease and the controls and restrictively to observe the exposure to test their associations. And when we go back to the history of case control studies, possibly the first case control study was done by Gall's comparison of the occupations of men with primary consumption to the occupation of men have other disease. And actually, the first modern case control study was Janet Klemper's study of the breast cancer and the reproductive history in 1926. So when we talk about a case control study, we need to have some characteristics of this study in mind. What is typical characteristics of case control study? And that's why it's different from the other study designs. The first characteristic is that case control study is a type of observational and analytic study. We call it observational because we only observe the participants of this study. We don't have any interventions for them. And it is an analytical study because we will differ case control study from the cross-sectional studies, which we only have an observational and descriptive approach to the participants. We call it analytical study because we have some hypotheses to test. And the second, when we start to have this case control study, we usually need to set up comparison. As we have mentioned in the definition of the case control studies, we see that we will first have the cases that participants who have this disease, and then we select controls who do not have this disease. When we select these controls, we have to compare the disease and the non-disease people. So that's called a comparison. And the third characteristic is the process from the outcome to the causes. Because we first define the disease outcomes, we first know that who are the persons with the disease and who are those without the disease. And the second step is to restrictively see what's the cause of these diseases, to see what is the exposure. So the direction of this kind of study design is from the outcome to the causes. And this type of study design, when we use case control studies, we can test the hypothesis of whether the exposure is associated with the outcome, but cannot confirm this hypothesis. That's because it is routinely tested this kind of hypothesis from the outcome to the causes, and which will be biased by this direction, that is a restrictive direction, but not prospectively. Now let's see, this is an illustration of this case control study. And first, we can see that in the real time, pointing at the very sharp now at the real time. And this is when we take this study. And when we take this study, we will separate the participants with according to whether they are ill or whether they have this disease. And then we retrospectively assess of their exposure history. So the exposure maybe occurred very long time ago, and the disease occurrence was between the exposure occurred and the study takes place. This is again that we can show more detail about the percentage of the exposure among the cases and the controls. That we can see in the upside, the cases have about half and half exposed to the exposure, while the controls, only a very small part of the red part are exposed to some exposures. And therefore, we can see that in the cases, the percentage of exposure is very much larger than the percentage of exposure in the control group. And when we compare these two groups, such as to compare the percentage of exposure, then we will know that's what the difference between these cases and the controls according to their exposures. Now, let's take a look at an example of the case control study. For example, if we want to assess the association between smoking and lung cancer, as Dunn and Hill did in 1950s, we then need to do as they have proposed in this paper published in British Medical Journal, that whether smoking was associated with lung cancer. So we would like to compare the odds of smoking among lung cancer cases with the odds of smoking among controls without cancer. And in their study, those controls without cancer can be diagnosed as other diseases. However, in their study, the problem was that the control population, lung disease other than cancer, was biased in relation to the exposure. Despite this, their finding was suggested for the cohort study of smoking and lung cancer later on, and build up the foundation for the association for the test for the smoking and lung cancer in the history. Another example is Herbst's study on Stilbestro and vaginal adenocarcinoma. Herbst and his colleagues reported a retrospective study in 1971 on the association of maternal Stilbestro therapy with tumor in young women. Adenocarcinoma of vagina in young women were very rare diseases. They found several patients with this condition in a hospital between 1966 and 1969, and therefore a case control study was conducted with 8 patients born in this hospital between 1946 and 1951, in search of the factors that might be associated with the tumor appearance. And 4 matched controls for every case were obtained by personal interviews. And the main result shows that 7 of the 8 mothers of the patients with carcinoma had been treated with dilacetyl stilbestro, started during the first trimester of the pregnancy, while none of the control groups were treated so. So it is therefore suggested that the maternal ingestion of stilbestro during the early pregnancy appears to be the risk factor for vaginal adenocarcinoma, and which could be developed later in the offspring exposed. There are other studies that was important in the history of the case control studies. Besides the cigarette smoking and lung cancer study done in 1950s, the dilacetyl stilbestro and vaginal carcinoma study done in 1970s, the postmenopausal estrogen and endometrial cancer in 1970s, later on in the 19, we can see the association between aspirin and rare syndrome, which was done in 1980s. And later on, other studies such as the tampon use and the toxic shock syndrome, the AIDS and sexual practice were also observed in case control studies. And in the 1990s, the focus of the case control study has changed a little, and many other disciplines come into the view of the case control study. For example, we can now study the effectiveness of the vaccines. And there are also various studies focusing on the causes of cancer, which is mainly due to such as side effect, and which was also performed using the case control study design. Now, let's see what are the types of case control study based on whether it is matched. So the basic idea for a case control study is to select one whole group of cases and one group of controls. However, when we choose a group of controls for the comparison with cases, there are some characteristics of the controls may differ from that of the cases, such as the sex, age, or race, that may confound the association between exposure and the disease. For example, when we conduct a case control study on smoking and lung cancer, if more older people in the case group and the age is associated with the occurrence of lung cancer, as we know. If smoking is correlated with age, then it's possible that overestimate the association of exposure and outcome. In order to solve this problem, we may take some measures to keep the age distribution in both cases and the control group in a balance. One method is to use the matched design. Here, match is defined as the process of making a study group and a comparison group comparable with respect to certain characteristics, such as sex, age, race, and socioeconomic status. For example, when one case is a 55-year-old man, we might choose another 55-year-old man as a control in the eligible persons who meet the criteria of the controls. When the case is a 40-year-old woman, we choose a 40-year-old woman as control. Finally, when we compare the exposure proportion between cases and controls, sex and age distribution must be in balance between these two groups. Then we may control the confounding from the variables of sex and age. Therefore, the purpose of the matching is to reduce the likelihood of confounding. What variable is matched? Confounding caused by this variable would be controlled. Here, we listed about the advantage and disadvantage of matching when we do a case control study. The advantage of matching may increase the precision of case control comparison and thus allow a smaller sample size. And the sampling process is easy to understand and explain. And if analyzed correctly, it provides reassurance that the matched variable cannot explain the case control differences in the risk factors of interest. However, there are several disadvantages for the matching in the case control study. Matching process may be very time-consuming and expensive to perform. And some of the potential cases and controls may be excluded because matches cannot be made. And the matched variables can't be evaluated as risk factors in the study population. So please be careful that if we match some variables, we cannot analyze it later on in the study. So if this is the variable that we are also interested in the later on case control and study analysis, we then should not match it in the design part. And for continuous or ordinal variables, matching categories can be too broad, and the residual case control difference in these variables